It's here, your local chiropractor back pain relief center, and this is our Tuesday edition of Dr. Ray TV. I apologize, I'm just getting over this cold. I think maybe a few more days and it should be done, so if I'm a little scratchy, that's what's going on. But we're going to talk a little more about chronic pain today, and just some new thoughts on it and some stuff that I'm learning lately that is encouraging for patients that have been suffering from pain over an extended period of time, and how maybe there's some different things to help you manage it besides kind of the normal thing. So, you know, typically, and even really up until this day, how I treat our chronic pain patients, at least when they come to see me, is pretty standard care. You know, what we start off with is a full exam, a review imaging, meaning MRIs, CAT scans, reports, things like that. If they don't have it, we send out for it and kind of get a history on the patient, and then we begin some treatment. And treatment usually consists of some spinal manipulative therapy or chiropractic treatments, some soft tissue work, some different physiotherapies like electric stim, ice, laser, things like that, all designed to try to increase function or decrease dysfunction, get inflammation down, and trying to get the person back to as normal of a range of motion as possible. With our chronic pain patients, and when I say chronic pain, I mean patients that this has been reoccurring off and on for an extended period of time without good results, meaning they may feel a little better for a while and then they relapse or have an exacerbation or reoccurrence of their pain. And it doesn't seem like they can ever get over that hump and feeling better. So what makes it chronic? I don't know, maybe 6 months, maybe a year. I think every person is different. I think it's more when we're not fixing the problem and the problem continues. So not so much a time thing, but a problem of getting it managed. So we typically start out with a month of therapy, chiropractic therapy, and if we're having difficulty with their pain levels, I refer them out to either pain management or their primary or an orthopedic, and get the aid of some appropriate medication for them, whatever the medical doctors deem appropriate. And we kind of do that for a month or so, and we see how they improve. If they don't improve to where it's acceptable for them or for us, the next step is some injections, and we do, the doctors usually do a series of injections anywhere from 1 to 3 over, you know, the next 3 to 6 months or even a year. And in conjunction with continued therapy, we try to get their chronic pain manageable. Now look, for a lot of people, we get them to a good spot. You know, maybe, you know, off the top of my head, 60-70% of our patients, by following that typical protocol or the very standard protocol care, they begin to get better. They're in an acceptable pain level for them and function level for them. Here's a problem. That's not good for everyone. There is a percentage of patients, maybe 25 to 30% of patients, where even that standard protocol care just doesn't seem to work. And what we have to do is ask ourselves why, and why isn't it working, and why aren't we getting them any better, and why are they switching from doctor to doctor and not really getting results they want. If you see me looking down, it's just because I'm just looking at my notes. Because if I did this 100, I know it's live, but if I did it 100% off the top of my head, I would stumble a little bit. So I'm still getting better at that. But anyway, so standard care works for about 60 to 70% of our patients. The 25 to 30% is the ones that I'm worried about, and we're learning new things. So let me take a step back. If we go to that point where we've done all of our standard care, we've tried interventional pain management, we've tried conservative treatments, and we're still not getting to that point, what we would do in the past is send out for a surgical consultation. And I think we all know that that's not our best option. I've heard studies where they say if you get the surgery and if you didn't get the surgery, we're at the same spot in 5 years. So it's not giving you a lot of relief. And quite a few of my chronic pain patients have already had the surgery and they're still back into seeing us. So what does that tell you? I think the surgery does a really good job at what they say they're going to do. They shave off the disc, they fuse it, or whatever they're going to do. They do a good job doing what they say they're going to do, but it disrupts the biomechanics of that whole lumbar spine or neck, and we have problems down the road. So, you know, today I'm coming to you from our Myrtle Beach office, and a good friend of mine, Dr. Lally, who's a cardiologist upstairs, He's going to be opening up a medical wellness center, and these things are really intriguing and interesting, and I think it's the way things are going to begin to go here in the future. And with medical wellness, they're looking for non-allopathic ways to get patients better. So non-medication, are there other things out there that may be able to help? And I think there are a lot of things out there, and it takes some talented or gifted doctors to start researching it and get away from treatment in the norm and try to get patients better. And everything that I'm getting to here that I'm going to start talking about is all very new to me, and I'm learning as we're going on. So I'm going to keep on giving you guys more information as I learn it, and I'll give you my take on it and what I understand about it. So when we look at a chronic pain patient, excuse me, we have to ask ourselves, why are they in chronic pain? So typically, if say, and I'm just using it for example, degenerative joint disease, and when we look at spinal problems, whether it's your neck, mid-back, or low back, it's usually because of dysfunctional joints, pressure on the disc and on the nerves, they're degenerating and they're inflamed. So we're looking at two things. We're looking at dysfunction, so the body isn't working right for whatever reason, and then we're looking at inflammation, and that inflammation creates pain. So how do we globally, over an extended period of time, get the patients to move better and get the inflammation levels down and get their immune system up and get them healthier? Well, there's some really interesting new therapies, and they're new to me anyway. I'm sure they've been around a little while. Number one is nutrition. Nutrition's been around a long time, and I'm not a expert on it. Like I think Dr. Lally, and I'm not positive, but he may have a PhD in it. But there's a lot of nutritional things out there. For example, I hear a lot of interesting things about D3 that can help manage chronic pain. Because if we have a pain patient and they're in this chronic pain for an extended period of time, and we keep on throwing medication, what is that medication doing to the body? And is it really working when we look at an extended period of time? Now I get it. There's a time and place for pain medication when you're debilitated and you can't move and things are hard. There's a time and place for it, but we got to try to look at other things that can get us better. So certain vitamins, certain diets, a lot of interesting news out there about vegan diets and how it can help control some of these processes. Again, this is all new to me, but I'm just kind of throwing it out there so you guys can maybe start Googling it and getting some more information. So there's interesting things about your diet, vitamins, and things like that to help overall this inflammatory process. If we can keep pain levels or inflammation levels down overall by things that we eat and things that we take, we can build our immune system, get it stronger, and not have to rely on the pain meds as much. So nutrition's one thing. Another interesting thing is these whole body cryotherapy machines. So there's these machines out there, and they kind of, to me, look like a stand-up tanning booth, except your head is popped out of it. And what happens is the patients go in there, and they lower the temperature with these nitrogen tanks, something absurd, like 150, 200 degrees below Fahrenheit, something crazy like that. And the patients can only handle it for 30 seconds to 3 minutes. And what happens is its whole body is an anti-inflammatory effect. And again, I'm going to research this more and get some more stuff to you about it. But they say doing these cryotherapy techniques are a way to recover from a lot of this dysfunction, get overall body inflammation down. And there's some other interesting things about it, that the cryotherapy actually stimulates your immune system and stimulates different factors in your body that help you recover. A thing that I do an awful lot besides cryotherapy, I do manipulations under anesthesia, and they're meant for chronic pain patients, and they're meant to break up adhesions and scar tissues in the muscles and the joints to regain function, to regain mobility, to decrease dysfunction. Again, helping the patient on a global management process, get them to function better over an extended period of time. What else is out there? Let me see here. Supplements, nutrition, whole body therapy, manipulation under anesthesia. There's also some interesting stuff out there about infrared saunas. The hot rooms you go in. Well, they've been using these infrared saunas, and I guess that infrared light stimulates your immune system, and patients get better or feel better. And when I say all this, I don't think any one of these things is a golden ticket. When you have chronic pain, we talked about this yesterday, you really got to find what works well for you. And these are all examples of things that may help improve what you're already doing. Again, just briefly, nutrition, chiropractic care, manipulation under anesthesia, whole body cryotherapy, whole body infrared sauna. I think there's a lot of interesting things out there that can begin to work. And why do we need to look at these alternative methods? And I think the way medicine is pointing eventually, pain medication and pain management is going to get more and more difficult. Typically, and I've seen in the past, they're prescribing, Percocets and oxycodone and all these other things. And with the way that the heroin epidemic's going and the way the government's coming down on doctors and all these different factors, eventually it's going to be very difficult to get certain medications. So if you're on something like that, and which is all good, it's prescribed by your doctor, it's all good, but those things will get harder and harder in the next few years. I think it's going to be more and more difficult to get into a pain management doctor. They're really going to scrutinize more and more what they do in order to get you better. So I think we need to start looking at these new alternative therapies. I'm a big fan of chiropractic, spinal manipulative therapy, obviously, because that's what I do. I do believe there's nutritional things that are going to play a big, big part of it. And there's some new stuff coming out there. And I think we just need to get that out there because the meds are going to stop working eventually. The shots will stop working eventually. And we can't be doing surgery on everyone because that's just not a great option. All right, guys. I hope all is well. I know I may have went off on a tangent there a little bit, but it's stuff that I'm interested in. And I'm going to be bringing more and more to you. If you are suffering from any kind of chronic pain condition, even if you don't think that chiropractic care is appropriate for you or that it can help you, maybe you even think that it hurts you, you can still message me. I've been doing this, over 18 years. I'm used to seeing things like this. I'll give you my honest opinion. Even if you're not a patient of mine, I'll point you in the right direction. Just message me on Facebook. I think I'm on Instagram also. You can message me there. And you can always reach us if you're down in South Carolina. It's myrtlebeachwalkinchiro.com. Again, that's myrtlebeachwalkinchiro.com. Up in New Jersey, we're backpainrc.com. Again, that's backpainrc.com. All right, guys, everyone have a great afternoon. I hope all is well. If you want me to talk about a particular topic, please message me, and I'll make sure I research it and give you my best opinion on it. All right, guys, have a great afternoon, and I will talk to you soon. Bye-bye.